Have you ever heard the term Ischiofemoral Impingement? Well, it's literally a pain in the butt, and I mean that in the most literal sense possible. If you're dealing with strange, unexplained hip and glute pain, then this video could be the answer to your prayers. So buckle up, because we're about to unpack everything you need to know to tackle this pain in the butt head on. So what exactly is ischiofemoral impingement? Picture this, you're going about your day, but there's this persistent nagging pain in your butt, and it feels like someone is pinching you from the inside. That feeling could be ischiofemoral impingement, or IFI for short. It happens when your quadratus femoris muscle, located between the ischium, part of the pelvis, and the femur, thigh bone, gets squeezed between these two bones. Normally there's a nice gap for the muscle there, but sometimes it's like trying to squeeze into jeans that are 2 sizes too small. It's just too tight. As noted in a 2018 Journal of Orthopedic and Sports Physical Therapy study, IFI can often be misdiagnosed because it shares symptoms with other types of posterior hip pain, and that's why understanding IFI is crucial. According to that 2018 study, posterior hip pain has many causes, such as piriformis syndrome or sacroiliac joint dysfunction. So if you need help identifying the root cause of your pain, the doctors of physical therapy who run my VIP mentorship program will do that for you during the first step of our process. This is a professional assessment with a hip specialist who's experienced hip problems themselves. Once we know the root cause, we can understand and heal it. So why does IFI happen? It could be due to a variety of factors. Sometimes it's just how your body is built. Maybe your thigh bone is a bit too friendly with your hip bone. Or perhaps it's because of weak hip muscles, particularly the abductors, which are supposed to keep everything in place, but maybe they're just not doing their job so well. The good news is we can address these things. So who should be on the lookout? Well, IFI loves to target highly active people. Think runners, dancers, and pretty much anyone who pushes their hips to the limit. It seems to pick on women more often, possibly due to differences in hip structure. Not cool, IFI. Not cool. So what does it feel like? Well, IFI is tricky because the symptoms are a bit sneaky. The pain starts mild, just a bit of discomfort in your buttock or thigh, but the pain can ramp up over time, especially when walking with long strides or sitting for extended periods. For my fellow sprint enthusiasts, IFI can definitely mess with your running stride, so be careful. So now let's get to the part that everyone's been waiting for. How do you fix it? The first step usually involves manual therapy by yourself or from a professional. Think about getting a deep tissue specialist to work on things and loosen things up in that area, but of course you can do it yourself as well. Next, strengthening those hip abductors is key, kind of like giving them a pep talk so they can keep your hip and thigh bone in their own corners playing nicely. And don't forget about exercises to calm down any nerve irritation that might be sneaking in. Here's specifically what I'm talking about. Step 1, tissue work to release those tight muscles. So to start, you'll want to release any tight muscles in the hip area. This soft tissue work is crucial for loosening things up in the quadratus femoris, glutes, and hamstring areas, which can all contribute to IFI. To do this, you can use a lacrosse ball or a JackKnob or 2 on the glutes. The areas you want to target are the quadratus femoris, piriformis, and other glute muscles. So use a lacrosse ball to gently massage these areas, spending extra time on the tender spots. This helps reduce muscle tightness and improves blood flow, setting the stage for better movement. Step 2, stretching to increase muscle flexibility. Next, you're going to want to stretch the key muscles around the hip. Stretching helps increase the ischiofemoral space, reducing the pressure on the quadratus femoris muscle. To do this, we're going to do a couple things. Let's start with the hamstrings. The standing band hamstring stretch. To do this, use a band to gently pull your leg backward while hinging at the waist. The benefits is this is going to loosen up the back of the leg, the hamstrings, and potentially increase the ischiofemoral space to ease that pesky buttock pain. Then let's move on to the glutes, the wall glute stretch. To do this, lie on your back and put your feet on a wall. Cross one leg over the other and gently pull your knee towards your chest. This loosens up hip rotators, which can help increase the ischiofemoral space and ease that pesky buttock pain. Step 3, re-education. Strengthen and stabilize. Finally, it's time to re-educate your muscles with targeted strength exercises. Strengthening the hip rotators and posterior chain also helps to stabilize the hip joint and prevent further impingement. Side-lying leg lifts on a bench. Lay on the edge of a bench and engage your core. Then, lift your legs slowly with control, feeling the outer glutes. The benefit of this particular exercise is the extended range of motion gives you a bigger stretch on the glutes and more muscle activation. Side plank with hip abduction. To do this, hold a side plank and lift the top leg. The benefit of this is it combines core stability with hip strength, addressing the hip joint's stability and mobility. One leg step-ups on a low box. To do this, focus on one leg at a time, stepping up while maintaining balance. The benefit of this is it directly engages the muscles that stabilize your pelvis, improving your balance and strength. So here's the wrap-up. Here's how to fix hip pain faster. By incorporating these simple yet effective exercises into your routine, this will help you address the root causes of ischiofemoral impingement by loosening tight tissues, increasing flexibility, and re-educating your muscles to move correctly. Stick with it, and you'll keep those hips happy, healthy, and pain-free. If you want to heal your hips and get your life back without surgery, check out gotrom.com/FAI for our do-it-yourself hip program powered by the TSR system. If you want personalized one-on-one help implementing the TSR system, book a free one-on-one to see if you qualify for our VIP mentorship program. And as always, please remember, you're just one step away from building or rebuilding your perfect body.